This is All India Radio. In the program Spotlight now, we bring you a discussion on National Girl Child Day ensuring equal opportunities. The participants are Dr. Ranjana Kumari, Director, Center for Social Research, and Aditi Tandon, Journalist.
India has been celebrating the National Girl Child Day since 2008. Ranjana ji, this year the theme is draw the attention of all citizens towards the fact that the child sex ratio in the country is declining very fast. Prime Minister Narendra Modi today hailing the women and girl power of India with the hashtag Desh Ki Beti. What is your overall view?
Any nation, if you want to really assess its level of development, then you have to look at their women and girl children especially. And when we see 5 issues on which India every time has been pushed down by the UN Development Indicator, most important, the question of girl children. What I'm saying is that one, that we are having less girl 5 age group less than boys, children who are born and survive, especially in the context of female child sex ratio is declining. And then the other issues which are very important to pay attention to are the education of girl children. It has been a big challenge to make them enter the school. In fact, the entry in the school has increased, but at the same time, retention in the school after primary to middle level has still been very, very challenging. Now, the third very important issue which we know about the health of girl children, especially when they reach the menstrual age. And then all kinds of question of health and hygiene comes very, very clearly before all of us. Important thing to note at this stage during especially COVID pandemic is the increase in the girl-child marriage. We have dramatic increase which has happened because a lot of girl children have dropped out of the school. And as a result, this has become really, really a major challenge for all of us to deal with. And in future, this is going to create more problem because all these children who got married will face the cycle of violence, bad health, unemployment and everything else. Now also, finally, I would say the fifth challenge which is before us in terms of education is skill of the girl children. If they go through normal education process, they do not acquire skill which can give them any kind of economic possibility in future and they can stand on their own feet. So these are the things I feel are very important, these 5 challenges before us in the context of girl children. Beti Bachao, Beti Padhao has been a very important initiative of government. We have participated working in 5 districts of Haryana. Fortunately, very intensive work and our comprehensive strategy has worked and the data is now changing in favor of the girl children. But still, it's a huge, huge challenge before us because now the next census is going to come just within this year. It should start now. And then we will have to see how much all these efforts has really made sense at the end of the day.
A very important report was brought out by the Ministry of Statistics and Implementation a while ago, and it had projected that although in 2011 census, the sex ratio of the country was 939, which is 939 women as against 1,000 men. It is projected to actually fall to 898 by 2031. You have been working on the ground with the government in terms of the Beti Bachao, Beti Padhao Andolan, and the messaging has been very sharp. The Prime Minister himself had launched that program. Is the law failing us because long-term projections don't seem to be improving yet?
There are multiple reasons, of course. I have been also a member of the PCPNDT board which makes the assessment. Unfortunately, meetings have not taken place to review for almost over a year now, where we would get information from all over the country, from all the states, about the number of cases detected in terms of sex selection, the kind of nursing homes which are really engaging themselves in it, and also doctors, sonographers. All those information will be collated together and presented, and we came up with many strategies in the past. But pandemic again has, in our own experience, slowed down the whole process of that the appropriate authority at the district level has not been as proactive. Everything has been left to ASHA workers. Now that's not really having much impact because they have very little say in the system. So certainly we may get a big shocker when the new census comes, especially in certain states. I would say the picture will never the same in everywhere in the country, but in some states we may get a big shocker that the sex ratio has further gone down. But certain states have done definitely better, where implementation has been robust. That would mean that law has been implemented. People who engage in gender-based sex selection have been punished, where we have had, regular meetings because every quarter you are supposed to meet and review. So the states which have gone for regular meeting and agencies like us, which have gone to the grassroots level and tried to create the groups of community people, elected women representative, elderly of the village. So this kind of group has helped in really doing a good public campaign. But, pandemic again has been a big blocker in terms of what we could do really in terms of public campaigns. So I would think that unless the law is really very, very seriously implemented and a lot of people get punished for doing this practice is not going to be stopped. And it's not just the practices because we have the mindset. We have some preference mindset which is changing but not really changing the way it should be changing in terms of welcoming the girl children. Still, we are not welcoming our girl children, and that is why a lot of parents go for sex-selective abortions.
Ranjanaji, there's a very important research that has taken place. Although we know already that women tend to live longer than men almost everywhere in the world, in some countries by more than a decade. But now we also know through study of centuries of historical records that women don't just outlive men in normal times, they are also more likely to survive the worst of circumstances, especially famines and epidemics. Do you think the women workforce and women generally would survive the pandemic better, and that would be one way of going forward?
Well, initially the data was, you saw a lot of reports, and I think where during pandemic, because women start with weak health, and that starts as girl children's health. And that is why I'm saying that if we want a robust country, we want our country to be seen and also, be a developed country, then we have to invest a lot in girl children. Because, this not only in terms of having the future generations who have better health in terms of having their ability to produce children, but becoming stronger and healthier mothers, but also capacity as workers, capacity as human resource for a country. If we want to ensure all that, then we have to invest in them as very young. So there are different growth phases for children, and we know it that from 0 to 5, if you are going to look after them and give them a level of protein, nutrition, and it's not just feeding them the right food, feeding them the right amount of protein, feeding them the right amount of vitamins, minerals. I think those are the things which needs to be still. Again, the Anganwadi work really got a very big setback during this period. We have worked during pandemic as COVID-1 and COVID-2 recovery programs, and we know that there was big difficulty that was faced by Asha and Anganwadi workers. They are the first point of contact who really reach out to girl children. They have all the information about the health of girl children. So I think they found it difficult and the programs were not managed very well during this period. And I'm flagging this issue to let the policymakers know that, they should get back to it now and try to streamline it and make it as effective as possible. Also, one reason when we don't invest in young girl children about their health, then we saw in pandemic, India is the only country where women died more than men during the pandemic. As a result, you can see what happens when you don't invest in women's health as girl children's health.
No, actually, we have looked at the Ministry of Health case fatality rate and mortality data for COVID. I would differ with you here because they do tend to say that males died more than females even in the pandemic. But your larger point is very well taken that investments in this sector have to begin. And I would like to draw your attention to the fact that the fear of violence against the girl child is also, one reason why a lot of mothers become complicit in getting rid of the girl infant. And a lot of studies from the rural heartland have actually proved that because women who bear girl children suffer domestic violence much more than anybody else, they ultimately become a party to this kind of discrimination against girl child. Is there any data from your own studies to that effect? Because that is a major mindset issue because violence against women is increasing by the day.
I think it's important let me go back to my point about women dying more. I think still the data is disputed because the data which came to us about 3.3% women dying and 2.7% men dying. was from an international agency, and of course then Health Ministry has contradicted that data by some research that has been done. Anyway, we can leave that alone, but I think it's important to note and underline that when girl children are getting married as young brides, then the possibility of violence on them increases because their vulnerability and dependence on husband, on their family is much more, and then the possibility of their getting exploited is much higher, and that is why you can see, and also then they become young mothers, and mothers at a very, very early age, then certainly that's also a form of violence actually. Why push a woman's body at that immature, unprepared age to go and produce children? I think this is also a form of violence, but a lot of us are accepting it as natural as girl-child, marriage. I think it's not normal, should not be accepted. And the increase in again, if I quote some data, we have lots of data collated together, but because also as a political scientist and as a researcher, I would not really quote any data because this is just 19% more girl children have got married during this period. But then these are the data which are coming from sources may not be acceptable to a lot of policymakers because still we don't have a very comprehensive research done during this period. But observations, a lot of activists who have gone around the country, a lot of women organizations have observed this and they have reported all this data about girl children and getting many more marriages of girl children happening. So I would still say that these 5 issues, investing in education of girl children, our investment in health and education still has not crossed more than 3%. So I think now this pandemic should teach us that we have to invest a lot in girl children's health and education. That means investment should be doubled at least, if not tripled. And also that we have to look at the other social evil side, which is the girl-child marriage, also skilling girl children, which is extremely important. Education is not enough unless there is good skilling happening from the very early age among them, so that they have a possibility of earning their livelihood. And then once they are on their own feet, certainly chances of violence reduces.
Very important finding by the International Institute of Population Sciences, yes, which actually does give us some hope going forward, Ranjana ji. They performed a 3-decade study of the National Family Health Survey data recently, and they published a very interesting paper where they said that although the dominance and preference for sons continues to some extent, but the scale of previous rigidity around the mindset of not having girls at all is now gradually waning. Even in high son preference states of Punjab, Haryana and Maharashtra, they actually found that the proportion of couples with only 2 daughters who accepted sterilization grew between National Family Health Survey 1, which was conducted in 1992, to NFHS 4, which was conducted in 2016. So that's a very interesting trend. So that means somewhere we are succeeding.
Sure. That's where we take a little bit of credit for very intensive work for so many years as nodal agency in Haryana. And I told you the district we work, data has reversed. And the data has reversed means that there has been an impact on the mindset of people about son preference. But overall, when you look at the country, UP, Bihar, Odisha, states which have Madhya Pradesh, we have so many cases which have come to our notice about violence against women, about, girl-child marriage, Rajasthan, there are critical states. And I think in this phase, it is important, and especially on the Girl-Child Day, we should reinforce our will to really directly make plans where direct benefit reaches to girl children and the issues which are really critical in the context of girl children are addressed, especially in the states which are critical states. So that very area focus, strategic focus has to be kept in mind when we want to go and make some change in the states. But there are certainly, you are absolutely right, and I have gone through the research study that you are quoting, and certainly mindset to some extent has changed, I would say. But there is a long way to go.
On that note, Ranjana ji, wishing you all the best in your endeavors and hoping that the child sex ratio trend reverse very soon. Thank you so much.
Thank you.
You were listening to a discussion on National Girl Child Day, ensuring equal opportunities. The participants were Dr. Ranjana Kumari, Director, Center for Social Research, and Aditi Tandon, Journalist. This program was produced and presented by the News Services Division of All India Radio. You can listen to it on our mobile app, News on AIR. This program is also available on our website, newsonair.com. You may email your opinion about this program at airnsdtalks@gmail.com.